Hello and welcome to IRM, India Revival Mission. Over the next 30 minutes, we would ideate, debate and talk about important laws and changes which need to be done in order to kickstart the growth momentum for the economy. And specifically, we will be focusing and taking a deep dive on the healthcare sector. The healthcare sector right now needs A, attention, B, investment, and C, prioritization. So what really needs to be done to ensure that healthcare in India is affordable and healthcare in India is of high quality? The healthcare sector will only grow if fresh private sector investment is encouraged. What can be done to do that? To address that, I've got two veterans, Dr. Devi Shetty of Nayarana Healthcare, and then we got Dr. Raghuvanshi of Fortis Healthcare. Gentlemen, welcome to the show and thank you for joining us. Dr. Shetty, if I may start the discussion with you. The healthcare sector right now needs to be prioritized, especially after the kind of gap which has been discovered after the pandemic. So in order to ensure that the government spend, which has now increased for the healthcare sector, is prioritized and it is having a huge multiplier effect on the sector and also on the economy, what are the policies which need to be adopted?
The most important change we need to bring about is the way to increase the skilled manpower, especially medical specialists. Now, central government has dramatically opened up higher medical education in their recent regulation just about a few days ago by opening the National Board of Examination, which is like a larger university, to conduct the training program in virtually any hospital in the country with over 100 beds. Now, what is the implication? The implication is that Karnataka state alone, the government, over 170 government hospitals will now become postgraduate institutions, training thousands of young doctors as medical specialists. This will dramatically transform the way healthcare is delivered by having adequate number of specialists in all the public and private hospitals. But now the ball is in state government's court. If all the state governments start launching this course across the country, believe me, in 5 years' time, India will become the first country in the world to dissociate healthcare from affluence. We will make it happen.
Right. Dr. Raghuvanshi, the Prime Minister in the Independence Day speech emphasized on the medical system and how it needs to be changed and how there is going to be a unique identity on the lines of CIBIL or Aadhaar. How can this be implemented?
I think it is very important to have continuum of care. So if the system is fragmented, the primary care and the secondary and tertiary care are fragmented, then there is a lot of wastage which happens in the system. And in a society like ours, where the resources are scarce, I think it becomes even more important. So this is a very good initial step. It is very ambitious. I think the kind of infrastructure which will be required, the security concerns on data privacy, etc., will have to be addressed. But I think the government has chosen a path which is, I think, really sort of a way ahead of its time. No nation of this size has been able to do something of this magnitude. So I think this will be a game changer as far as the patient continues center, or they go to a private hospital or they go to a public hospital, they will be able to go through the whole process without any problems.
Now, Dr. Shetty, if I look at the ethos of Nayarana Healthcare, it has always been centered around care and purpose-driven growth. So, if the per capita for the healthcare industry is going to multiply, where do you think investments they need to migrate now? Should one be investing in creating infrastructure? Should one be creating in technology / digital adaptation, or should one be focusing on training and perhaps more skilling?
It's very important that large amount of resources are invested on building the digital infrastructure. We were the pioneers. India was one of the first country in the world. 17 years ago, we were treating patients online when there was no internet with the ISRO satellite. But till 3 months ago, telemedicine, even though every politician, every policymaker was talking about it, was illegal. Only 3 months ago, our government made sure that it became legal. That really opened the floodgate of telemedicine. Today, sitting in my house, I see 20 to 30 patients every day. I see patients in remote locations of the country, patients talking from their thatched roof house in a remote northeastern region to me, sitting as if they are talking to me in front of me, sitting in front of me. This is a major change. Now, for this to really get converted into realistic care, we have to build a digital infrastructure. We have to take away the pen and paper from the hands of doctors, nurses, and technicians. Once this happens, first, healthcare will become safer, it will become affordable, and it will become accessible.
Now, let's also spend a minute trying to understand the need of the physical infrastructure. The COVID crisis, in a sense, has exposed that how weak our physical infrastructure is. What needs to be done so that the physical infrastructure in India really reboots itself? Outside the major metros also, some would argue that there's lack of hospitals, there's lack of connectivity, there is lack of medical equipment. Smaller towns, the situation perhaps is even more fragile. So what can be done, or what can be prioritized to create the physical infrastructure? Digital infrastructure can enable you with better diagnosis, it can enable you with better information, it can enable you with better transmission and delivery, but ultimately you need physical infrastructure.
See, the infrastructure will only come if the private sector as well as the public sector starts making investment. Now, for the private sector to make investment, there has to be a robust payment mechanism. If more than 70% of the country's population still dig into their pocket to pay for the healthcare, we are not going to scale up the healthcare. So it is very important that there is a financial intermediary like a health insurance entity will come up. Now, government did a phenomenal job in launching the Arogyashri scheme in various states and the central government's the health scheme. So this has covered almost all the poor people, but there is a large number of middle class people who are not covered by these schemes. At the same time, they don't have money to pay for it. If a model of low cost, affordable health insurance, like a health mutual comes up, then large number of Indians will be able to pay. Then without any effort, many hospitals will come up by the private sector because it is viable. Right now, private sector will not be very comfortable in investing money because of the limitation of paying capacity. But this will change once digitization happens and healthcare becomes an issue discussed at the political front. Dramatic transformation will happen.
Now, Dr. Raghuvanshi, what will attract private capital? A is surety and perhaps a guarantee of return. Now, in the healthcare industry, some would argue that in the past there have been a lot of interventions or price caps or regulations which have been introduced by the government. A case in point here is what happened in the cardiac care, what happened in knee operations. Is that a big deterrent for investors and for firms like yours? Because once you are creating an infrastructure, if a price cap or a regulation kicks in, the idea is to make them more affordable. But from really your standpoint, do you think that's going to be a deterrent?
I think because that is probably the key why the investments are not coming in adequate amounts in private sector. One has to understand that our demographics is such that, as Dr. Shetty said, majority of people are putting hands in their pocket to get money for healthcare. So it is unrealistic to expect them to go to a private healthcare sector and pay the realistic prices, what it costs in private healthcare sector. So public healthcare system in this country is going to play a very, very important role. Private healthcare sector cannot replace what the public healthcare sector needs to do. And I think that distinction has to be very clear in policymakers' mind and in every other segment of the society's mind, that private healthcare is not a replacement for public healthcare. And that is when the private healthcare will go parallelly, and it will only complement the public healthcare system. That is the ideal way of doing things. Even if you look at a system like in United Kingdoms, where the public healthcare system is very robust and one of the best in the world. If you see there is a thriving private healthcare as well. But the private healthcare is not replacing the public healthcare. It's only complementing it, and it is supplementing it. So people who require a certain level of service or are desirous of getting that level of service and can afford to pay for it, they access that part of the care. So I think in a country like India, where majority of people are economically disadvantaged, it is very, very important that our public healthcare system is made robust on private sector will not be there.
Now, Dr. Shetty, let's talk about medical tourism. And at Narayana Health, you've adopted this whole model of cross-border tourism very, very smartly, especially in Northern America. What can be done to increase India's presence in the medical tourism? And at a time when everybody is talking about becoming more self-dependent, do you think medical tourism in India, which has a very great scope, is unlikely to pick up? Because on one side we are focusing on Atmanirbhar, and on second side we also want to prioritize medical tourism.
There is no doubt that there is a great potential, but more than the medical tourism, there is a desperate need for healthcare workforce across the globe. There is shortage everywhere. So if our education, medical education, nursing education, paramedical education policies change to tweak our curriculum to suit the requirement of not only India, but the first world countries, we will be able to actually dominate the global healthcare delivery system. Global healthcare delivery is a $8.2 trillion industry. It's the largest industry in the world. And the most important component of this are the doctors, nurses, and medical technicians. If we can train 5 million doctors, nurses, and medical technicians who can find very well-paying jobs outside India, we can earn $100 billion of foreign currency every year. This is the most exciting opportunity. Now, it is an existential threat for India because in the next 10 years, there will be shortage of over 80 million health workforce across the world. No country in the world has a plan to prepare the workforce for that. If you do not plan, you will be in trouble because it takes 14 years to train even a surgeon who can operate on the hand. So that is a time gap. Now, if we don't produce the workforce for the rest of the world, what will happen is when they have a shortage, they will open their doors. Then no law in this country can prevent doctors, nurses, and technicians fleeing our country to practice in those countries. So we need to start making investment, looking at the shortage and the need across the world than our own requirement.
Great point, Dr. Shetty. So, Mr. Raghuvanshi, what Y2K did to Indian IT services, do you think COVID could do to the healthcare system? Because it in a sense will enable, it will prioritize, and it will ensure that all pieces of the healthcare system, they assembled very, very quickly. The Indian healthcare system was evolving, but it was evolving almost at a snail pace. Now, do you think rather than moving at a snail stroke or tortoise pace, the speed is going to be important, and this crisis more than anything else has been an eye opener, and healthcare and digital adaptation for the healthcare system will now be prioritized?
Absolutely. I think I completely agree with what Dr. Shetty was saying. I think the medical manpower can be created not only for us, our own need, but it is imperative that we create it for the larger requirements of the world. Otherwise, we will have a situation of deficiency for ourselves. And the way it can drive our remittances and the way we can take a leadership position in healthcare by doing so is extremely sort of evident and very, very clear that the same story of Y2K, or maybe even a better one, can be repeated in India. We would serve our own healthcare needs, but at the same time, we will also create a kind of a big economic driver for the country and the rest of the world.
Last couple of questions, Dr. Shetty and Dr. Raghuvanshi. I'll start with you, Dr. Raghuvanshi. You've been constantly, coming on our network channels and on ET Now, and you've been guiding us, suggesting us, and you've been, in a sense, educating our viewers as to which way the COVID crisis and the curve is moving. What is your sense? Because we are nowhere close to the peak. The number of fresh cases are only rising. What is your sense on where the COVID crisis is headed?
Yeah, I think it would not be wise to drop our guards. I think what this crisis has brought to all of us is that prevention and preventive health and good health is something which is the key. So I think we should not lower our guard. It is true that the numbers are coming down all over the country, but you can have another surge. Mostly, if you look at the historical, pandemics in the earlier century, and there were 3 peaks which happened, and that it lasted for almost 2 years. So there can be resurgence of infection rates, etc., in India and abroad. And as the relaxation happens in the travel and other restrictions, that can happen. So I think my advice is to everybody that they should remain cautious. They should not stop doing what they are doing or what they need. However, they must follow all the standard.
Dr. Shetty, closing comments from you as well. And before a wrap, thank you once again for coming on the Times Network and educating our viewers and sharing your experiences as to how one should really handle the COVID crisis. But I guess perhaps what everybody is waiting, anticipating and hoping is for a breakthrough in vaccine. What is your sense? How far are we really away from a real breakthrough there? And what is your sense on the efficacy of the vaccine?
I'm optimistic that we are heading towards the end of the crisis, but I wouldn't say that the crisis will go away. COVID is going to stay. It may last for at least a year or a year and a half. But the intensity of COVID will definitely come down. This we can see our own pattern in Delhi, in Bombay, and in Chennai, and few other places. Now Bangalore is on uptake. We are nearly reached the plateau. I hope soon we will start coming down on the numbers. So the same pattern will go across the country, all the cities, all the towns. So on the whole, we are in the right direction. And God willing, if the vaccine comes up, entire rules of the game will change.
So just one more quick question, Dr. Raghuvanshi. In your understanding, if a breakthrough, let's say, happens before the end of this calendar year, October, November, how soon do you think the entire India would be vaccinated?
Oh, it is going to be quite a task, but I'm sure with the awareness levels, this could happen rather quickly. But I think a vast country like India, it would still take some time, at least a year, before we can have a very reasonable rate of vaccination.
So are you saying, Dr. Raghuvanshi, that we should wait for at least a year, if not year, at least for 8 months before we can start dropping our mask and start ignoring social distancing?
Yes, probably that's right.
Well, really appreciate your time, Dr. Shetty, Dr. Raghuvanshi. Thank you for being part of India Revival Mission. With each passing day, this market is becoming better, and with each passing day, this market is only telling you that if you've participated on every decline, you've actually made money.
ITC's credo is nation first, sab saath bade. I would like to live this philosophy in whatever business we do. We continue to be very well diversified across product lines. The general health of the company continues to be very strong.
We are a publicly listed company. We have access to capital. We have great brands.
No, beautiful question. Yeah, I can tell you, we believe that we'll be able to reduce costs.
ET is one of my favorites in the world. I'm a fan.
This is a very insightful question that you asked, Nikunj, and almost seems like you were listening in on the deliberation the committee was doing. And you're absolutely right.
And if this cup of coffee is costing you 25 rupees right now, after 5 years, it may cost you 100 rupees. Predicting the market or predicting the short-term move in the market, well, that's always very easy. Predicting it right and making money, it's not impossible. It could be a challenge.